Hello everyone, ladies and gentlemen. I would like to quickly introduce myself. I am the author, Hajar Al Saadi, a fourth-year pharmacy student in Al Ain University. Today I would like to present our project with the title of Healthcare Professionals, Knowledge, Attitude, Practice toward COVID-19. This project was supervised by Dr. Amira Shaban, and my teammates Rahma Eid and Aya Al Ali were a crucial part in this project. Before I start, I would like to take this opportunity to send a message for all healthcare providers all over the world. Thank you for all that you are doing during this crisis. As a pharmacy student, I feel so inspired by all of you who is risking your lives for the greater good. Your work is not going unnoticed. Not all heroes wear caps. Today, they wear scraps. We all have been affected by the current COVID-19 pandemic. However, the impact of the pandemic and its consequences are felt differently depending on our status as individuals and as members of society. The nature of healthcare providers' occupation put them at increased risk of getting any contagious disease, including COVID-19. They are on the front line of COVID-19 outbreak response and as such are risk of contracting this virus, so a proper knowledge, attitude, and practice evaluation is required in order to assess the ability of our healthcare providers to contain the spread of the current pandemic. Our main objective is to evaluate the knowledge, attitude, and practice of UAE healthcare providers in their attempt to contain the spread of the infection. The method we use to conduct such as evaluation is by using a cross-sectional survey that was prepared and distributed to various UAE healthcare providers. The survey includes 15 questions, 5 knowledge, 5 attitude, and 5 practice, as a total of 150 responses were collected using various platforms and methods like social media and physical interview. And all participants were briefly informed about the aim of the study and given sufficient time to fill and submit the questionnaire. Responses to the questionnaire were collected and assessed. Now heading to the result and discussion section. When measuring the healthcare provider's knowledge, there was a universal agreement between the healthcare providers that social distancing by 1 to 2 meters, hand sanitizing, and using alcohol-based sanitizer reduce the chances of getting infected with COVID-19. While for the attitude part, a big percentage of the healthcare providers showed fear of giving medical attention to respiratory infection patients, fearing that they may have COVID-19, while a huge percentage believed that complete lockdown is an effective measure to slow the spread of the infection. 47% of the physicians are refusing to take the newly developed vaccine, while the percentage is 14% and 13.3% in pharmacists and nurses, respectively. Finally, the practice part, there is an agreement between healthcare providers that workload and working hours increased during COVID-19 pandemic. To the increased number of the hospitalized patients and the evaluated medical attention needed. This was reflected in that healthcare providers weren't able to wash their hands during their shifts. To sum up everything that has been stated so far, the evaluation of KAP survey showed the healthcare providers were at the acceptable level in containing the spread of COVID-19 infection. Furthermore, healthcare providers are still needed to professionally develop themselves to ensure the most effective care is provided to the patients. This is our references, and this is the survey question barcode. You can scan it and see our survey. This brings us to the end of the presentation. I would like to thank you for your time and attention today. If there is one thing I would like you to remember from today's presentation, it is that our healthcare providers are the heroes of this world. Thank you.